Hi, Assalamu alaikum and welcome back to my channel. Abdul Rahim here with you. So we are going to start the imaging. Okay, so today I'm going to explain you what are the main images or what are the main positions from where you are going to get the images. Okay, you can call them windows, positions, or the areas where you are going to get the images. So there are mainly four windows. Okay, one is a parasternal window, which is just near to the sternum, either on the right side or on the left side. So you are going to get the parasternal views. The images you get it from the parasternal window is called parasternal views. The next one is the apical window. You go on to the apex of the heart, okay, and you get the images from there. That's called the apical windows or apical images. Then you go into the xiphoid area or the subcostal area where your rib area finishes, or your thoracic cavity finishes, and just the abdominal cavity starts. Just the end of the sternum, you put your probe there and you get the images from there. This is called subcostal images or subcostal windows. And then the next one is this one, the suprasternal notch. You get the images from this suprasternal area and you call suprasternal images or suprasternal notch images. Okay. So these are the main windows or main areas from where you are going to get the images. Now every window has their subviews as well. For example, in parasternal windows, you are going to get the left parasternal window, and in some cases you also need to get a right parasternal window. I'll explain you when and how and why you are going to get it. Okay. And then in parasternal, once we talk about the parasternal images, it's mean the left sided parasternal images. So then parasternal images also have their subviews. For example, long axis, parasternal long axis and parasternal short axis images. It all depends upon your angle and direction of the probe's marker. Okay. Then you go on to your apical views, and in apical views there are subviews. For example, apical 4 chamber, apical 3 chamber, apical 2 chamber, apical 5 chamber. So these are different images which you are going to take it on the apical views. Then you are going to the subcostal views. In subcostal you can take mostly all the images, but mainly you are going to see the interatrial septum, okay, and then IVC and abdominal aorta. And then the suprasternal images are the suprasternal images where you will see the arch of the aorta and these things. Okay, there are no more subviews. In pediatrics they take more views, but in adult echo, if you can take suprasternal images and you can see the arch of the aorta, that's fine for you. Okay, so these are the main images, main windows. I'll explain you slightly about the probe as well. Okay, so this is the probe which you use for the echo imaging. It has its parts, okay, which will help you during the imaging. Okay, so if you look at this one, in every probe either there will be a light here or there will be a mark here. Someone call it marker, someone call it eye of the probe. Okay, so whatever you call, but this is the main thing. Okay, so some probes do have a light here, this one doesn't have it, but you can hold. So this is the marker of the probe, this is the base of the probe where you put the patient's chest, and this is the tail of the probe. So you need to know all these things, because once you are going to take images, you need to move these areas, or you need to do different maneuvers to get the better images, or to change your images, to change your angle. So you need to know where is your where is the marker of my probe, where I need to keep the marker of my probe. So you need to know this. Okay, so that's all. In the next video we will be starting the parasternal long axis images and also the parasternal short axis images. Okay, till then, thank you, take care, bye bye.